Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, foodborne illnesses. We're going to help you avoid giving your guest food poisoning this holiday season. Also, diabetes, new management and treatment options. And do you have a living will? The Baptist Health Chaplain is here to help us discuss that. Also, Meals on Wheels is here. Tonight, my first guest is Dr. Walaa Ayoub, who you're an endocrinologist with the Lexington Clinic. Is that correct?
That's right.
All right. And endocrinologists deal a lot with diabetes, and that's pretty significant in Kentucky.
It is. And thank you for having me tonight. And speaking of numbers in Kentucky, unfortunately, according to the most recent data from the CDC, it is estimated that we have 1 in 8 Kentucky adults with diabetes, and about half of them, they don't know that they have diabetes, and it's also estimated that we have 1 in 3 with pre-diabetes, which is a predisposing condition to diabetes, Dr. Fox.
So that keeps you pretty busy, especially in Kentucky.
That's right.
All right, so I mentioned new management things, and one of those things is called CGM. So what's that stand for, and what's it mean?
That's a great question. So CGM stands for continuous glucose monitoring, and as you know, as technology advances, newer products are available to help people with diabetes take a better care of their diabetes. A perfect example of that is CGM, which is a new technology that is used to check glucose levels day and night. The way this technology works is by checking glucose levels in the very thin layer of fluid between cells known as the interstitial fluid, and it does so by means of a very teeny sensor that is placed in a very simple way under the skin, with a wear time that ranges between 7 days up to 6 months so far.
And you can read that in real time on your cell phone or other monitors?
So the data that are recorded on the sensor are transmitted wirelessly to a reader for the sensor, or actually more easy, you can have the data right onto your smartphone by just downloading an app on your cell phone, which is pretty easy.
So why is that better than just sticking your finger and finding it?
Great question. So first, hassle-free, no finger sticks. You don't need to poke your finger to get a glucose check. What is more important is, I call CGM the full picture. If we look at traditional blood glucose monitors, when you check your blood glucose, they give you your blood glucose at a single moment in time, while CGM, it has to do with the trend. It tells you what your blood glucose levels are and what they were and where they are going to. So it gives you an idea about a full picture, and we call it's a connection. It connects the dots between blood glucose readings.
So it can warn you if you're real high, but it also can tell you if you're real low. It's sometimes as bad as high.
That is actually sometimes a low blood glucose, as you said, if it's not as bad, it's actually worse than a high blood sugar, especially, unfortunately, people with long-standing diabetes, sometimes they lose those monitoring symptoms of low blood glucose, so they don't feel that, which is a phenomenon. We call it hypoglycemic unawareness, and that is very important when it comes to continuous glucose monitoring. Most of the commercially available monitors, they come with the option of alarms, either in the form of a ring or a vibration mode, that actually can alert patients when their blood glucose levels are outside the customized target range, and patients can take necessary action to correct their blood glucose, whether it's very high or very low or predicted to go low soon. So this is a great advantage. Not only that, clinical trials and studies have shown people using CGM, they actually have a more stable blood glucose. They spend less time in low blood glucose and less time in high blood glucose, and they actually was found to have less risk of diabetes-related complications.
So we're coming up on the holidays here, and I know you're not supposed to cheat on your diet, but some of the diabetics will. But with continuous glucose monitoring, they can say, uh-oh, I ate that piece of pie, I shouldn't have, maybe I need a little extra insulin, or is that not what it's designed for?
That's a great question, and from a practical standpoint, I see wonderful stories of success from patients, despite the fact that CGM is not a treatment, but by giving patient the ability to track their blood sugar, day and night, they come to tell me, you know what, I ate this slice of pizza and my blood sugar was 500. I will never do that again. And in addition to that, they can also modify their dietary habits, they can modify their activity, they can decide actually on their medication dosages, including insulin and other medication used to treat diabetes.
You need a prescription, or can you just buy them?
It is, so far it's a prescription, but we're getting more and more better insurance coverage. So the indication, another good question is, who is a candidate for CGM? Right now, all people with type 1 diabetes who are on insulin via injections or insulin pump are candidate. Likewise, all people with type 2 diabetes insulin treated. Also, people who have trouble recognize the symptoms of hypoglycemia are perfect candidate for this technology, and patients who are willing and enthusiastic to make changes in their dietary habits, activity levels, to get a better blood sugar control.
That's great information. We appreciate you coming in.
Thank you. Appreciate it.
And if you've got diabetes, you may be a candidate for CGM. Check with your doctor. We'll be right back.